Hi, my name is Rebecca Moshiri. I'm the Director of Patient Services at the Georgia Transplant Foundation. GTF was founded in 1992 by Tommy Smith, a kidney transplant recipient. GTF is focused on providing both financial and educational assistance during a time that's often overwhelming for those undergoing or waiting for a transplant. Today, I will tell you about the programs and the services that we offer. GTF's programs can be split up into financial assistance and human services. I'll tell you more about each of them. Some of the financial assistance programs are available to pre-transplant patients who are working to get UNOS listed or who are already UNOS listed. First, our dental assistance program. Some centers or insurance companies require patients who have sources of infection to get dental clearance prior to being actively listed. If your transplant center has told you that you need to get dental clearance, GTF may be able to assist with the cost of your dental treatment. Next, our insurance premiums program. GTF offers assistance with insurance premiums for non-Medicare actively listed patients. For example, if you've been working and you have your health insurance through your job, but now you're unable to work due to disease progression, you need to keep your insurance coverage, but you may have reduced or no income. GTF may be able to assist with your insurance premiums for a few months. We also offer an evaluation assistance program. If you have to travel more than 75 miles to a transplant center to be evaluated for transplant listing, GTF may be able to assist with some funds towards your travel and fuel costs, and also lodging if you need to stay overnight. You can work with your dialysis center social worker or your pre-transplant social worker at the center to submit an application. We also want to make sure that you know about our Living Donor Assistance Program. It's a program that can assist potential living donors with their travel costs to be evaluated, and then also again at the time of donation. We can also assist with household bills if the donor will experience income loss during recovery from donation surgery. We also have many programs to assist transplant patients and their families post-transplant. Our emergency assistance can help with household bills such as rent or mortgage and utilities to help offset income loss related to transplant. We also have a medication assistance program. Taking your transplant meds as prescribed is extremely important, and we never want the cost of the medications to stop patients from taking their meds. GTF can assist with the cost of meds to allow time to apply for manufacturer assistance programs and work with your transplant social worker. We also offer lodging assistance. Patients who live a distance away from the transplant center often need to stay for a couple of weeks post-transplant. We know that that cost is in addition to your usual household bills, and it can be a huge burden. Our program can assist with lodging while the transplant team wants you to stay locally. We can also assist with lodging for follow-up visits during the first year post-transplant. We also offer insurance premiums assistance. One of the most important keys to your transplant health is keeping your health insurance. Sometimes a job loss can make it hard to afford insurance premiums. Dialysis patients who get transplanted, who have been receiving assistance for their premiums through AKF, will lose that assistance post-transplant. GTF can assist with insurance premiums to give families time to come up with a plan to afford their premiums. We also offer transportation assistance. New transplant patients have many follow-up clinic visits in the first few months post-transplant. GTF can provide some funds to help with the fuel costs of traveling back and forth to the center. So there are some rules and guidelines for GTF's assistance programs. You must be a legal permanent resident of Georgia. You need to be UNOS listed or you've had a solid organ transplant. There needs to be a situation of need related to your transplant. and you need to submit an application through your dialysis or transplant social worker. You need to reach out to them to discuss the situation and to work on your GTF application. All of our financial assistance programs are meant to be short-term assistance to help during a time of crisis, to give you time to figure out and get a long-term plan in place. This slide just shows the amount of GTF's funding that's spent on the various types of financial assistance programs that we offer. As you can see, a large part of our funds are spent on emergency assistance for families, medications for patients, and housing or lodging for patients to get needed transplant care. GTF services are offered all over the state, from Douglasville to Brunswick to Columbus, Athens, and Toccoa. We have patients who have utilized our fundraising and financial assistance programs. Another type of GTF assistance is our Transplant Fundraising program, which offers a way for transplant patients to prepare financially for their ongoing transplant costs through fundraising and a matched grant. To be eligible for a transplant fundraising account, you must apply and be approved pre-transplant in order to be eligible for matched funds. You have 1 year from the time you're officially accepted in the program to raise funds, and up to $10,000 will be matched. Matched funds can be used post-transplant for prescription meds and insurance premiums. A small amount can be used for miscellaneous medical expenses. We have over 3,600 people who have transplant fundraising accounts, and they have raised over $9.8 million. Many people hear fundraising and immediately think of holding a fancy event or think that they can't be successful because they don't have rich friends. We want you to know that both of those thoughts are misconceptions and that anybody can fundraise successfully. We normally hold monthly fundraising classes at the GTF office and also at our Trends in Transplant conferences, but we're currently making that class available online. Please attend this class in order to get many tips and easy-to-use methods for your fundraising. We also offer academic scholarships. GTF knows that transplant can cause many families financial hardship that makes it difficult to save for or to afford college. For that reason, we offer multiple scholarships annually. Some of the scholarships offer one-time $1,000 grants, and many of the scholarships offer $1,000 for up to 4 years. People who are eligible to apply include recipients, the dependent or spouse of a recipient, the sibling or parent of a child transplanted when they were 22 or younger, and living donors. Applications must be postmarked by June 1st of 2020. Please see our webpage for the application and more details. GTF also offers many human services that I will tell you about now. The Mentor Project. It offers a chance for pre-transplant patients, caregivers, and potential living donors to be matched with trained post-transplant patients, caregivers, and living donors. So you can talk to somebody who's really lived through a transplant. You can request a mentor on our website or through your social worker. You can also let us know if you're post-transplant and would like to be trained to be a mentor. Our Jumpstart program is a transition to employment program. You can work with our counselor to update your skills and your resume. She can connect you with Voc Rehab if needed, and she also knows how to work with programs such as the Trial Work Period, which offers incentives for the disabled who would like to try out returning to work. She can also help you get a Schedule A letter, which helps with federal government hiring. GTF offers conferences for dialysis patients, pre-transplant patients, and post-transplant patients and their families to attend. They offer transplant-specific health topics presented by transplant doctors and healthcare professionals. We normally offer them in cities across the state, including Macon, Albany, Savannah, Columbus, and Augusta. We usually offer our Atlanta Trends and Transplant conference in the fall. This year, because of COVID-19, we've had to cancel the conferences in all of the outlying cities, but we are still hopeful to hold the Atlanta TNT in October. These conferences provide a great opportunity for transplant patients and families to connect with other people who are going through transplant. We also provide lunch, and these conferences are free to attend. Please look for more details on our website. Transplanted children often miss weeks of school and frequently get behind in their studies. GTF offers assistance with tutoring for transplanted children under the age of 18. Please talk to your child's transplant social worker to get more information about this program. GTF is happy to offer a couples enrichment weekend every other year. It takes place at a retreat center on St. Simon's Island and is available for long-term committed couples. The transplant recipient must be at least 6 months post-transplant and medically stable to attend. For many couples, the transplant process has been turbulent and leaves little time for the couple to focus on their relationship. They're just trying to get through the crisis period. So this enrichment weekend offers the time for couples to focus on themselves and their relationship. If you're interested in being placed on a waiting list, you can email me at rmoshiri@gatransplant.org. Please let us know if you're interested in volunteering with GTF. We have a variety of opportunities and can always use help with clerical duties in our office. Thanks so much for learning about GTF's programs and services today. To get more information about any of these programs, please visit our website at gatransplant.org. We're also on Facebook and would love for you to like and follow our page. Thank you.